The gentleman from Georgia, Dr. Price.
The gentleman from Georgia is recognized for 3 minutes.
Thank you, Madam Speaker. Madam Speaker, health care at its very core is a compassionate and a moral human endeavor. As a physician, I can tell you that I never saw a Democrat or a Republican disease. The medical decisions that each American makes for themselves and for their families are some of the most important and personal decisions ever made. And there are principles of health care that we should follow. Think about those principles of accessibility and affordability and quality and responsiveness and innovation and choices. Think about those principles. None of those principles are improved by the further intervention of the federal government, which is why we should adopt and concentrate on positive, patient-centered health care reform. It's so very important that principles be in place that will ensure that patients and their families and their doctors are able to make those personal medical decisions unencumbered by a stifling and oppressive federal government. But sadly, this bill will not allow those independent decisions and is wrong in so many ways. This bill on page 94 will make it illegal for any American to obtain health care not approved by Washington. This bill on page 301 will force Americans to purchase health coverage that Washington picks, not that you select for yourselves. This bill on pages 297 and 313 places job-killing taxes on virtually every single business. This bill on page 211 will force millions of Americans to lose their current personal private health coverage. This bill comes with a price tag of $1.3 trillion, which will be borne by our children and our grandchildren. This bill on page 520 slashes billions of dollars from Medicare that will necessitate health care rationing for seniors. And this bill on page 733 empowers the Washington bureaucracy to deny life-saving patient care if it costs too much. This bill is not a health care bill. This bill is an affront on the morality of the provision of American health care. As a physician, when patients and their families and their doctors are not allowed to independently decide what care should be provided, we lose more than our health care system. We lose our morality and we lose our freedom. This bill, whether known or not, is an oppressive affront to every single American. The positive vote, the bipartisan vote on this bill is no.